Skidmore, and this meeting is being recorded. Just so everybody knows, full disclosure. Thank you guys for joining us tonight. I'm very excited to have an old friend, although we're not using the word old. We decided Jeff Scott, who's the general counsel of Florida Medical Association. And we had an interesting session. Jeff is going to do a quick wrap up, and then we'll open it up for questions if you all have any questions for him or even me. And Jeff, take it away. Thank you so much for being here tonight. We're happy to have you.
Thank you, ma'am. Absolutely. Thanks for inviting me. And thank you for your hard work this session. We couldn't have done a lot of the things we did without your support on the various committees, and especially on the scope of practice issues. You were just fantastic. Thank you. So what a difference a speaker makes. Last year, we had a speaker who was bound and determined to pass scope bills and punish the FMA in the process. The sheer number of bad pieces of legislation that were introduced was just amazing. I had never seen anything like it. This year, a much different story. We didn't have a speaker that was gunning for us, and things are much more civil, and we were actually able to get a few things accomplished. We were able to, early on in the session, pass one of our priority pieces of legislation, the COVID-19 damages liability bill. It passed both chambers, was signed into law by Governor DeSantis before the session was even over. That is going to provide a lot of protection from COVID liability suits for physicians as well as other healthcare providers, and it was a big accomplishment for the FMA. Another bill that was able to get across the finish line was the emergency management bill. It's also been signed into law by Governor DeSantis, and this bill creates a stockpile of PPE created by the state, manned by the state, and available for state governments, private entities in the case of another pandemic emergency similar to what we went through with COVID-19. This bill also, it had the vaccine passport legislation included in it, but that one does not apply to healthcare providers. You are free to require COVID vaccination or to run your practice however you see fit. The FMA was also able to get legislation passed that fixes most of the problems with last year's pelvic exam bill. As most of you know, that one created a whole host of problems, uncertainty, questions that we weren't able to get the state government to answer. The legislation wasn't easy. Some of the players on the House side made it difficult on us, but fortunately we were able to get the Senate bill adopted on the last week, and it answers most of the problems, although not all. We were fortunate to get that across the finish line. Another cleanup bill from last year that passed both chambers provides that the educational pamphlet that you have to provide prior to prescribing or administering a Schedule II opioid, that pamphlet now only has to be provided electronically. Previously, it was something that you had to provide in writing. And so those are a lot of the things that we were able to get proactively. Every year, defeating bills is almost as important as what we're able to pass. And this year, we were able to either defeat or significantly amend all of the harmful scope of practice bills that were introduced. Legislation that would allow APRNs to practice specialty medicine without a physician supervision, that was defeated. Legislation that would allow optometrists to perform laser eye surgery, that was defeated. Legislation that would that would give psychologists prescriptive authority, including for controlled substances for patients of any age, that was defeated. And legislation that would have allowed physician assistants to practice autonomously without physician supervision was amended. The bill that passed moved the supervision requirements from 4 to 10, and it allows for them to sign some documents that physicians would otherwise solely be able to sign. But the key provision was removing that autonomous piece. The FMA was also able to kill legislation that it's been around for about 7 years, and it would limit the amount of medical bills that you could recover in a third-party injury suit. We call this the limitation of medical payments bill. It did not get a hearing in either chamber. So that one's another one, probably be back next year, but for this year, we were able to kill that. A bill, an issue that is near and dear to several people in this audience, the Nika bill. That issue, talk about bad timing. The Nika program brought forth a bill that would increase the award for the parents of an injured child. Right while they knew that the Miami Herald was doing an investigative piece on the program. And when the piece broke, they lost control of the bill. And on the Senate side, it was amended so that the Nika program would sunset, that the tort exemption was weakened. A whole host of changes were made that would have increased the amount that Nika would have to pay, quite possibly bankrupting the program. And the physician assessment would have increased 3% per year every year. We were able to amend all of those provisions out of the bill, and while the final product was something that was acceptable to the Nika program, it didn't kill the Nika program, but it'll be certainly they will be back next year trying to enact more changes to that particular entity. Let's see, there was legislation that was introduced that would have changed the state's wrongful death statute, which would, if passed, would have resulted in significant increases in your medical malpractice premiums. That bill has been around forever, and unfortunately it was sponsored by a Republican in the House this year, and it actually passed the House, but unfortunately we were able to kill it in committee in the Senate. Disturbing trend, and we'll probably see that again next year. Another bill the FMA has opposed for many years, the repeal of the Florida's no-fault automobile insurance bill statute. That did pass. We were able to have language included that would make mandatory offer of MedPay such that you would have to opt out rather than opt in. We wanted it mandatory, period. We weren't able to get that. But at least it is a mandatory opt-out provision now. The governor hasn't gotten that bill yet, and there is some question about whether he will sign it. And of course, not every FMA-supported initiative passed this year. Our efforts to expand telehealth to ensure one payment parity and to make permanent some of the changes that the Surgeon General did via executive order during the pandemic. That bill was wrapped up in a Department of Health bill that failed on the last day. The FMA had legislation. We had like 4 or 5 different bills on insurance reform, retroactive denials, step therapy, cancer medications, and none of those were able to see. They didn't see any traction in the Senate, and they were watered down in one committee in the House, and that's about as far as they got, showing that the insurance companies have significant sway in the Florida legislature. There were a couple of bills that were problematic. We were able to make some changes. One of these, the parental consent bill, is going to be a problem, and we have sent out a notice. I think we sent it out today, asking physicians to contact the governor and ask him to veto this bill. There's a provision that, with unintended consequences would make it a first-degree misdemeanor for a physician to render emergency care at the scene of an accident to a minor without the parent's consent. Physicians volunteering their time at sporting events would not be able to render aid unless they had the written consent of the parent. Significantly handicapping, hamstringing physicians' ability to provide care to children when needed. We put out, like we said, put out that notice today, and if you can contact the governor and in your own words ask him to veto that bill, that would be helpful. There was a DNA testing bill that we were able to make changes to allow pathology and clinical laboratories to continue to do testing without running afoul of the prohibitions in the statute. There is something in that bill that may be a problem concerning routine DNA samples. We are working on that to get an interpretation. This bill does not, it hasn't been signed by the governor. It wouldn't go in effect till October 1st, and we're working on either a fix or a solution if indeed there is a problem there. So That's the session in a nutshell. And I'd be happy to answer any questions you might have.
Jeff, I have a question. I think you alluded to that, but Jackie Toledo's bill on regulating the PBMs, that died in the Senate, I assume?
Yes, it was. We had followed that, and that bill was significantly watered down from its initial iteration. From a physician standpoint, I didn't even see that there was much benefit to it in the final product, but I don't think that final product even passed.
Right.
That's proving to be a difficult nut to crack.
So originally it looked like the House bill was pretty good. I think it was unanimous that passed it. Because there was two components to it. One was just the PBMs and the switching part, but the second part was just the simple things like the generics. I've seen them tell patients that prednisone costs $150 a month if you don't get prior authorization, and then magically comes down to $40 when you can buy it for $5. And they were doing a clawback for $30, and making a profit off of people, even with the authorization.
Mm-hmm.
So that would have hopefully eliminated that. So it's disappointing.
Yep.
Thanks, Dr. Baca. Any follow-up? Okay, Jean Acevedo has her hand up. Jean?
Thank you, Kelly. Hi, Jeff. Good to see you.
Ma'am.
So, a lot of interesting stuff. Some of which, as a compliance professional, I know my firm's Florida physician clients will be interested in. So the FMA typically does a really nice job of a summary write-up. Will one of those be forthcoming?
I've done it. We've done it. It's finished, and I think we're putting the final touches on it. It should be ready, edited and ready soon, hopefully.
Excellent. Thanks. Good. Yeah, we'll continue to, as we typically do with these, pass it down, right? So that the docs understand what the FMA has been doing all year round, what they're paying the dues for, right? So, yeah. So some good work. Thank you.
You bet. Thank you, ma'am.
Thank you, Jean. Dr. Babick?
Yes. Who wrote the Nika bill? I got to see the Nika bill 3 days before passage.
That was me in a panic sending it to you.
Right. And I was amazed at who wrote 18 pages. And to me, it looked like a lawyer wrote the bill.
Well, the bill popped out. Well, it was an amendment. The initial bill, what passed was much different than what the initial bill was, and it was a product that Nika and all of these stakeholders, the FMA and all the specialties that were affected, the OBGYNs, were able to ratchet down from an amendment that Senator Book authored. Now, I don't believe that she actually wrote that. I would not be surprised. I don't have any confirmation, but my guess is that the trial bar was involved in writing some of that. But it was a big surprise that the Senate sponsor actually took that language and let it go on the bills, such that we had to then get it off. So the final product was a compromise between the Senate sponsor, Senator Book, and the Nika program, as well as other unseen entities that I don't know about.
Jeff, for the people that are on the call that are not familiar with Senator Book, her father, could you explain to these people who Senator Book's father is?
Ron Book is her father. He's probably one of the most influential lobbyists in the legislature. His firm is consistently in the top 3 revenue generators, of all the firms in the state of Florida. He's got a lot of clients, and he's been at this for many years. And he's a nice guy. I mean, I like him personally, but he certainly he is a influential fellow.
Thank you.
Thanks, Dr. Babick. I don't see anyone else with a hand up. Anyone have any questions? I don't see any in the chat. Jeff, do you have a minute to maybe talk about the upcoming FMA annual meeting and or any legislation? As most of the folks on the call know, we start early this year. We just got our schedule for committee meetings. The first week will be September 20th. So we are getting a head start. We'll be in committee September, October, and November, and then in session January and February. So a little bit different schedule. And I think a lot of us are excited about an in-person meeting in Orlando. So give us the scoop.
Yeah, it's we're going forward. I know that we're going to have the House of Delegates live and in person. We're going to have the Good Government Lunch that will take place this year in person. And the educational, the CME is going to be virtual. So we're going to be doing all of the CME online, and you'll be able to access that from anywhere. But otherwise, everything else that we would normally do at the annual meeting, we will be doing live and in person, and we can't wait to see everybody. So it should be good. We're looking forward to it.
Good. Does anyone have any questions about the annual meeting or anything coming up? Anyone have topics for legislation going forward, since we're going to have to start formulating that pretty quickly to be ready for September?
Yeah, Jeff?
Yes, sir.
One of the resolutions that is coming before the FMA is the question of who regulates the practice of medicine in the state of Florida. We've been told that the practice of medicine in the state of Florida comes under the supervision of the Board of Medicine. And if that's the case, then nurse practitioners are practicing medicine and should be under the Board of Medicine, or we got that confused?
Yes, the Board of Medicine does regulate the practice of medicine in Florida for physicians. Now, nursing, they can practice autonomously now under the new statute that passed the session before last, but they are practicing nursing according to the definition in the statute. They are not practicing medicine such that a physician is, which I understand that there's a little difference from a practical standpoint. And, we had language that would have put the APRNs under the Board of Medicine. We've had that ready to go. That's been a concept we've been looking to do. But unfortunately, Speaker Oliva was not interested in doing that at all. So that bill passed out with the nursing, with the APRNs able to do what they do autonomously under the Board of Nursing and not the Board of Medicine. So to change that, we will have to go back into the statutes and make a legislative change. I don't see that happening. I think we will do well to continue to kill any attempts by the APRNs to increase their scope of practice, as well as the other allied health professions. But that's kind of the status of where we are.
Thank you.
There's an interesting resolution that's coming up that talks about fee splitting. And apparently there are certain statutes about fee splitting with certain professions, including dentistry, would actually make it potentially illegal for dentists or other people to be owned by certain outside entities. Now the thing is that there was an issue with transparency in terms of billing. So for example, if a physician is owned by a company and they're billing from the ER or the anesthesia suite, some are complaining that they're not actually able to see their charges. And so they have no idea if these companies are fraudulently charging underneath their names, and using their licenses. And there've been some instances of overbilling and other things that the physician's not aware of, but they're technically, still responsible because that bill goes out in their name. So, it would be nice to see that there's some kind of legislation to protect physicians who are employed, that they have the right to see their actual bills, that are submitted.
Yeah, I've not heard of that legislation. That unfortunately, should be a contractual matter, and no
Right.
physician should ever sign a contract that does not give them the authority to see what's going out billing wise under their name. I mean, that just blows my mind that anyone would sign something like that. But I
I don't know if they're
understand that there
signing
are.
something that says that they're not eligible. It's just that when they ask for it, they won't get it.
Well, that should be a breach of contract, and they should have a legal recourse. If they're not showing you what they're billing, that's a red flag. And I would certainly insist to the point of, look, if you're not going to show me, then you're in breach of contract, and we're terminating this. So
Right.
I suspect that's what the legislature would say. But I do understand, though, that there are circumstances where physicians, their practice is purchased, especially by these,
Bird venture capitalists.
right, group venture, capitalists, and they, the terms of the buyout aren't exactly, favorable. So, if that's an issue that the board wants to take on, certainly, we'll be happy to do that.
Mhm.
There we go. Well, I see no more questions, Jeff. Everyone who's on the call, there are still some delegate slots available for the FMA annual meeting in Orlando. We'd love to have you join us for the first in-person FMA meeting in the last 2 years. So that's exciting. And I know a couple of our doctors on here will be there as delegates. And like I said, we're looking forward to that. Jeff, thank you so much for being here tonight and for all the work that you do. The great thing about the FMA is it's within walking distance from the Capitol. So I know whenever I need your guidance on a lot of these big issues that you're there to help support the doctors, and we certainly appreciate it. And with that, I thank you for the evening, and thanks everyone for joining, and we'll look forward to seeing you. Our town halls will be on sabbatical for the summer, so we will see you back for our next town hall in August.
Thank you.
Thanks,
Great.
everyone.
Thanks so
Thank
much.
you.
Nice
Thank you,
job.
Thank you. Have a good
Appreciate
night.
your